welcome again. Some music here interrupting. Yes. Come again, come again. Yeah, okay. We are continuing with the topic that we had. We reached somewhere, we had to cut it short. Mm, we had to cut it short, and and um, let me present. I'll present something. Hello. Eh, eh, yes, I'm in a meeting. Oh. Uh, 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 I'll present something and you will see it's very important when it comes to emergencies. And Miriam Mumbwa is in the house. And these things that we are talking here, they are very important. Imagine you are not a medic, and one day you just walk in your house and you find someone is not responding, someone is unresponsive. You try to pop this person, you should know the approaches of. Yes, Miriam. Hi. Welcome to the chat. We are talking about how to handle emergencies when you find them. Some people don't know how to handle emergencies. It's very important. And when we started by saying there are some simple steps that you need to do. You stay calm. This is some people panic, and getting a courage to getting that courage to. Let me give an example. You have entered your house and your kid has lied down. Is not responding. It is not easy to be calm. These things need you to train. So our first step, we say, this is just a talk, and practicing them at times help. So the first step, we said, you be calm, take a breath, speak slowly. If you are coming in right now, this is a continuation of a topic that we started. So I think you'll watch the other video, and then you'll catch up with us. Now you stay calm, you speak slowly, reassure the people that are around everything is okay. You see, everything is okay, so that people don't panic more. Sometimes people panic, and you're the one who should be the big one to calm down and release the panics that are around. Now, the second step on emergencies we talked about is you look at the danger signs. Some danger signs when it comes to emergencies. There are some danger signs that you should look upon. And these danger signs are these. You are walking, you are somewhere, and you see a group of people. Those people are panicking and talking to each other. They don't know what to do. Look at the person there. Is that person conscious? Is that person conscious? Is he responding? Is this person breathing normally? Because sometimes breathing normally is confused. I said about something called paradoxical breathing. Paradoxical breathing is whereby you are breathing, instead of your belly coming up when you are breathing in, it's going down. So you are breathing normally. When you breathe in, your stomach is supposed to come out. When you breathe out, your stomach is supposed to go in. So when you look at these differences and you're seeing someone is breathing in and the belly is going down, that is a serious case. It means chest. The chest has a problem and the chest has an injury. You should check about it. It's very important. Breathing. And then you say severe bleeding, chest pain, seizures. Is that person having seizures? Hmm? Is that person convulsing? Convulsions sometimes are normal to people who have convulsive disorders, but it's not normal for a person who is not having those complications. It's very important to check about that. Did this person, always ask this question? Did this person just collapse, or did this person just um, let's say, give an example. You are walking and you stepped into a stone and you swayed along and you fell down and you became unconscious. Those are the questions that you should ask. Is this person, if anyone knows this person around, is this person having convulsive disorders like epilepsy? You get it? As you call 999. And then we said, when you are at a site whereby a person is having a problem, you don't diagnose. If you are not a doctor and you are not trained, don't rush to diagnose. Don't rush to say, I think this is malaria because this person is so hot, and you touch that person. No, you don't rush to think about things you are not sure of. Some diagnoses leave them for doctors in the hospital. At times this happens. A person has convulsed and has passed out, and then when this person is okay and gains consciousness, when he goes home, he's given paracetamol and told you'll be just okay. That is a normal thing. If this person is not confirmed as an epileptic person, don't say the paracetamol helped. No, take this person to hospital, please. Let explain to the doctors. Let the doctors know what to do. Now, there are some things you can do when you are at an emergency a, a site area of of trauma. There are some things you can do which are so basic and they are so important. If you find someone is bleeding, let's say he fell down and is struck on something and this person is bleeding, please help to stop the bleeding. Help and be careful. And I repeat, when you go to you find an accident, you always get road traffic accidents. You find someone is not crying. This person is just lying there. Please always call medical assistant because you may make this person to be a paraplegic, not to walk again forever, because a broken bone can injure a nerve of the backbone as you push that person from those vehicles, and then it becomes a lifetime trauma. But if you left that person there and then the professionals come and then they carry that person as it is needed to a stretcher, they may help this person not to be a paraplegia. Paraplegia and hemiplegias are those people who cannot walk because of the spinal cord injury. So when you get to that scene, you are there. Everyone is panicking, and you are not doctors, all of you. You can do only basic things. If you are seeing blood is pouring out from somewhere, a lot of blood, do this. Apply pressure. As you wait for 9-9, a lot of bleeding can make things go wrong. And then there is something that is very important. You see, if a person has gone unconscious, you you can help ventilate the chest by making this person sleep like this on the left hand and the other leg on the other leg and sleep on the side. It helps to ventilate the chest so that the aeration and if there is something that happened on the chest, they can come out as we wait for medical help. You see, these things are very important when it comes to life-saving situations, basics. But I've told you, it is not simple. Imagine you've gone somewhere to visit a friend, and then you find a friend is lying on the ground, not responding. The first thing you will do is panic. It needs courage and training and talking as we are talking and talking. And if you have experience upon this, please bring them out. Let's see how your experience was. I remember the first time when we were in medical school and we went to see a cadaver. A cadaver is a board. It needed courage, but you see, those are our training facilities and assets. Some people ran away, Some people collapsed. Some people are sweating all through that lecture and orientation in the morgue. Imagine. So, as I'm talking like that, what I'm saying, it needs courage. It needs proper training and mental stability. But you see, by training, you will help a life. You will help to save a life. Hmm? So we continue. We've said there are those basic things like applying pressure on a bleeding place unconscious bleeding person on the side, on the left, so that if he has aspirations like mucus, what, blood, they can come out and enable the lungs to continue breathing and exchanging CO2 and oxygen, or help them sit or lie comfortably as we wait for medical responses. I'm saying this because most of most of the people that get to the site when there is a problem, most of them are not medics, and they make situations worse. So you are doing things as you are helping, but the problem comes, it ends up to be problematic because you are helping while destroying. Yes, you are at a situation whereby you don't know anyone. You are just there and you find people talking. There are some specific questions you need to ask. And these questions are very important. You know, not everyone has technicalities. Not everyone has technicalities of handling an emergency. But I'm here helping, just helping on how to handle emergencies when you are not a medic. You can know what to do so that we save the life or we save a person. You get it? Ask these questions when you meet some people around people. First, clear the people, tell them to move away from the person or the people that are injured. Ask those people what happened. They will tell you he was just walking and started conversing. Oh, you will know. Maybe this is a case of maybe he has problems with the brain and is used to. You get it? If the person is responsive a bit, you can ask where does it hurt? Where do you think you're feeling pain? If this person tells you around the chest or the back or I can't move, please don't touch that person. Make a call. Make a call 999 so that the medical assistance of emergencies can come save that life. Because if a person can't move and the pain is sharp from the back, that is another situation. It needs a medical assistant. Ask those people, what did you see? What did you see? Has it started now or is it abrupt? You get it? If a person has, maybe this person was sick. Hey, as we talk, please, if you have any question, medical question, anyone, even anything, even if it is not the topic that we are having right now, please put it down. I will answer. If it is private, you have my email address and you attach your number, we can link up on my email address. We continue. We're talking about saving people from medical emergencies that in a good way. Because I've seen so many people are being saved from emergencies, traumas, accidents, but it ends up that the people that are saving these people are doing more damage to the people. Hmm? Imagine you get someone in your home has collapsed. What you give is milk. This person maybe has gluten or protein intolerance, and you are still giving this person milk. This person will get problems. He'll get hypersensitivity, and this person will the lives will be short because if a person has collapsed and then you give something that will bring hypersensitivity. Yes, Mercy. Yes, kindly welcome to the chat. And if you have any medical question, let's interact. Maybe you know more. You know there are some things that people know than the doctors. Because let me give you a situation. When I was a second year student, I went to the way people go to visit children when they are born, the young ones, you go visit. So an elderly mom told us a child is carried by the right hand. He told mom, Bwana, a child is carried by every hand. It doesn't matter. So when I was studying and studying and studying pediatrics, it's a unit in medicine. I realized, oh, these old fellas, they know very many things. In this way, if you carry a young baby and neonate with the right hand, this baby will be lying on the left side. And it is important because of food. You know, when you are lying on the left side, digestion is better and you don't get reflux. So I don't ignore any word from anyone. You get it? So we continue here. You're seeing that we are at, so if you have any question or any additive, please bring it up. We interact. So we are here at the question that you should ask. You start by what happened, where does it hurt, when did it start, do you have any illness or allergies? Any person who knows if this person has any illness or allergy, are you on any medication? Look around. Is that person carrying any medication like the asthma medication, the inhalers? It's always salbutamol or a steroid called betamethasone. Those ones. Is this or Franon? Is he? You'll definitely know this person is asthmatic, and when you are making a call to to call an ambulance, you'll definitely tell them you need to come around with a nebulizer as you go to hospital. They are very important. Those questions are very important. As you go on, do not give random medication. Do not give random medication. Do not give random medication. If you don't know what this person is suffering from, like the way I've said, asthma and so, do not give random medication because you may be giving something that may escalate the symptom. But you see, if you've known this person is asthmatic, you can always give something like the inhaler puffs as you wait, as you go to hospital, you give it as you wait for professionals. That is known. But don't just give anything at an accident scene. If you are not a medical practitioner and you don't know, ask question. You cannot avoid painkillers. Don't panic when you see a person is not responsive and you start giving paracetamol. Maybe this person has liver damage, and you see paracetamol is metabolized in the liver. So you are creating the scene, the problem to be worse. You can when you bring a patient to hospital, there are so many things we look at before we give even a painkiller. Sometimes pain is a good signal. There are some painkillers that are metabolized in plasma if someone has a problem with the liver. So you're rushing to help by giving this person paracetamol or Brufen, the one which Kenya now is trending. I'm hearing everyone saying, Umempea Brufen. This means, have you given Brufen? My friend, Brufen causes acidity, it can cause hypersensitivity. So this is an accident, an emergency area, and you're giving that. It can cause a problem. And then we have leftovers antibiotics. When a person that has used, you see, you have helped, you have given the milk that people give, and then you start asking, the drug that I saw on the drawers, bring them, we see. No, take this person to hospital. Any emergency recovery, any emergency recovery, you found someone has collapsed and then this person recovers, don't overrule. Don't give antibiotics, don't give steroids, don't give paracetamols that were left over in the drawers. Tell this person or remind us on how to stop nose bleeding, please. Very important. That one I'll deal with it right now. Now, you see, nose bleeding is because of the veins and arteries that are dilated and they rupture on your nose. There are some factors. This is for Mercy Grace. Mercy Grace, there are some factors that you need to understand when it comes to nose bleeding. If someone is hypertensive and you find this person nose bleeding, the first thing you should do is to make the person hold the nose, check. Most of the people nowadays have their BP machines at home, which is very important. Those BP machines, rush for them. Now I'm talking about nose bleeding. Rush for them. Check the BP first. When you, a minute. Check the BP. When the BP is high, it makes the veins dilate and they rupture. So if the BP is high, find the drugs. Ask this person, did you take your medication in the morning? The person will tell you no. So you let the BP. Give the medication. Let the person sit upright the way I've seated, like this. This reduces blood flow up. I always see people when a person is nose bleeding, they tell that person to lie down and look up. No, sit upright. It reduces the blood flow to the nasal cavities here. You see? And then do what? You lean forward like this. You lean forward. This is about nose bleeding. Hold the nose like this. Pinch the soft part of the nose. The soft part of the nose is here. You pinch it using the thumb. Hold it firmly for 10 to 15 minutes. You get it? Breathe through the mouth. Breathe through the mouth. Because now, when someone is nose bleeding and is lying down, most of the pressure will be on the head. That is not good. So we have said you sit upright the way I'm sitting, lean forward, pinch the nose like this for 10 to 15 minutes, breathe with your mouth. And then, if you have ice or a cold thing, compress to the nose or the cheeks or the forehead. Why? When someone is cold, it makes the veins to constrict. It makes the veins. Yes, Miriam, you have a question? If you have, please just put it up. I'm answering Mercy. I'm answering Mercy. So when you've done that, apply a cold compress of ice like that. You apply everywhere. Apply a cold compress. I don't know if I have something, a dummy. I show you. We use dummies at times when we are teaching, but next time I'll find a dummy so that I can teach you with it. So we continue. You have applied. Sometimes there are some things that you can use like glycerin or liquid paraffin. Liquid paraffin helps those veins to constrict. Usually, when a vein dilates, it pours blood, but when a vein constricts, the blood is, even the clotting factor reduces. So those are the normal routine when you are at home. But there are some people who just nosebleed without even being hypertensive. Do what I've done. If for 10 to 15 minutes this thing is not coming out, it's not stopping, compress as you go to hospital. Take liquid paraffin, apply on a towel, compress. As you go to hospital, this person has seated down. Some people have genetic problems when it comes to clotting factors or platelets dysfunction. We call them platelet dysfunction. They have tendencies of bleeding. Those ones, we deal with them in the hospital. But in the home, if this cannot stop within 10, 15 to 30 minutes as you compress, it's still going on, go to hospital. Basi, I think I've tried to help, but most of the people, when you compress 10 to 15 minutes, it ends up to finish. If you give antihypertensive and the blood pressure goes down, it's okay. This most of them stops bleeding. That is the remedy at home. I don't know if you have other remedies. Yes, Miriam Mumbua has a question. I see raising the hand. Please, Miriam, I'm waiting for that question as I continue. Hope, yes, well understood. Good. We have said do not give random medication. It's not good to give random medication at a scene of emergency. Seek medical attention. Nowadays, we have a person we know who is a medical care, something, make a call. Ask a trained person nearby what to do. Call an ambulance. Nowadays, we have AMREF, very many ambulance uh, around. Ambulance is a business of its own. So there are some firms that do ambulance service. You can make a call. And as you make calls, you observe. There are some things you should observe when you are at an accident scene or you are handling an emergency. Look at the pulse of this person. Mostly, if a person is unconscious, are they turning blue? The lips, the eyes. If they are turning blue, that is worsening. This person is not getting enough oxygen. Is not getting enough oxygen. So shout out, seek for help, send someone faster with a bike, call a medical assistant for retrieval of this person to a medical facility. When you see someone turning blue within 10-15 minutes, that is an emergency. This person is not getting enough air, oxygen, and the chest might be having a problem. The chest might be having a problem. Is this person confused? There is a difference between confusion, incoherence, and inappropriate word. We need to understand that confusion is you are asking, is this person is responding, but the way is answering the questions is not the way you anticipate. How did you find yourself here? I want to cook ugali, but I was going to the shop. You see, I want to cook bananas, and I'm not seeing my father around. Do you know any person that we can contact? This person, you see, those are confused words. Incoherence. Incoherence is the person speaking things that you cannot understand. You have seen people talking incoherence. Those are signs that you should know there is brain damage. And inappropriate words is speaking things that are not related to the scene, inappropriate. So those are things you should check when you are at the accident scene. Vomiting. You may check the vomiting. Is it blood? Is it food? Is it watery? And is it, there is vomiting whereby I can vomit here, but there is a vomit that I can vomit and the vomits are going the other side, far away. When someone is vomiting and you see those vomits are going far away, just know this person had a problem from some times ago and it's coming from the stomach or the brain has a problem. Difficulty in breathing, that one we have talked about, is very important. And these are changes you need to see as you go on. Changes you need to see as you are helping, as you are pushing away people from the accident scene. As people are panicking, you are the one who is there helping this person to survive at all costs. It's very important. Protect dignity and privacy. Imagine sometimes you can go to, you get an elderly lady has fainted somewhere. Her clothes are, you understand? And these people are just there looking. It is very important to protect dignity and privacy. As we continue, please, I like that katham, like, like you like that, and share this video. This video might help so many people without you knowing. Even if it helps one person to save a life, it is very important. We understand. Yes. And many people, these things I'm talking, they don't know. But when they know, they can save one life. So just like and share them to everyone. It can save someone. Hmm? Dignity and Beatrice Kaloki. I'm saying my wife here giving me a thumb. Thanks, love. Thanks. Now, yeah, yes, we go on. Protect dignity and privacy. Cover that old lady. Cover that man whose clothes are torn. Keep crowds away. Keep crowds away. Keep crowds away. One, when you keep crowds away, what happens? You are helping oxygen circulation and privacy of the person we are dealing with. This is, we are living in a generation whereby when someone is when someone is is uh, is undergoing something, instead of people helping, they start filming everywhere. And you see, filming has no privacy. Once a video has gone online, erasing it is a problem. These are things we call dignity and privacy. Speak with respect, protect that person dignity. Follow instructions exactly when you are being told. So, there was a time there was an accident, and I was called in a home. And when I was giving instructions, these people are doing their things. Hmm? It is very important to follow the instruction of a medical practitioner who is on call, because there are so many things that we think they are not of help, but they help these people so much to survive. You get it? So those are the simple things that we do. Don't interfere with the doctors. When they come at the scene, explain everything and what you've done. If it is a home, explain everything, what you've found. If you found some bottles around, don't throw away. If you go in a home of someone, found that person is collapsed, and then you find some bottles that are smelling some funny things, don't throw them. They help us so much. Tell them, I found this, I'm find this, so that when they come, it is, if it is organophosphate poisoning and you go to the hospital, we already know we need to get atropine, we need to get this, we need to get this, so that we can revive this person so faster by antidotes, by drugs called antidotes. But if you throw those bottles or something that are at the vicinities, we may not know. It may take long to know. Why? Because we will take blood, go to the laboratory, start finding out what is in the blood system that is making this person collapse, to collapse or to pass out. But when we have them at hand, it becomes a very fast job. We just go to atropine. This is organophosphate poisoning. Start this, start this, start this. We save a life at faster rate. Hmm? You see? And after you have explained and everything, leave the person to the medics. But if a person recovers at home, I've said very important to take this person to hospital after recovery, because you don't know if it is a big problem which is coming or a small problem. Those are called emergency services or emergency operation at the cost of trauma, at the site of trauma, when you are not a medical practitioner but you can help. Please follow these videos and share them. They are very important. They save life, and they help people out there. Uh, I will make another, or tomorrow is a weekend. We may not have a topic, but we may come with an emergency topic. If someone comes in and tells me, please speak upon this, I will have to come. If anyone has a question, maybe this is the time you may ask. If anyone has a question, this is the time you may ask, so that we wrap up. Like 2 minutes, like 2 minutes, we wrap up. Like 2 minutes, we wrap up. Any question? I'm waiting for any question. Hit that like button. At least hit that like button. You see, when you like, you are promoting the page, and it makes impressions. When you like that, you hit that like, or you share. When you share, it goes. I'm speaking as, and I wait any question. Sorry, an ambulance is passing. I'm in the hospital where ambulances are brought. You see, that is an emergency. That is an emergency that is coming. When you hear that siren, you know it's an emergency coming in. Yes, and I can see the operation manager and the emergency team already around. So that is it for today, people, my good friends. And if I've said, if you have a question that has been uh, disturbing, or you really need to know what to do and you've not been close to a doctor, my email address, let me do it again. Let me put it there. It's called Benja Okwesh at yahoo.com. Write me an email on that. Send me an email on that email address. Attach your number. We will discuss. And if it is confidential, you don't want it to come private, I respect that. We will discuss uh, privately. But if you want us to discuss as a team, just write it there. I'll bring it as a topic. Everyone, wherever you are, this is year 2026. Be blessed and have good health. Always smile, even things are hard. Wherever you are, put on a smile. Pray everything to be good. Have a nice evening. Thank you all for being on this platform. Share, and always, if you've not subscribed, hit the subscription button as we continue to grow. Have a lovely evening.